Nearly half of the deaths of our age 15 to 24-year-olds in Oregon come from either suicide or substance use.
Unfortunately, experimentation these days can be deadly.
I've been to multiple overdose deaths throughout my career, both as just a patrol officer, as a patrol supervisor, as a narcotics detective, and really it impacts you in such a way because you're having to explain to the person's family through a death notification or the contact as you arrive, and the family's having to deal with that person who's overdosed, and it really does impact you.
I have the privilege of getting to work with some of the bravest parents I know in Oregon because they've turned their grief and losing their children into really a mission to make sure that that doesn't happen to other families. And what they tell me time and time again is they wish they would have known. You know, if their kids would have known about this hidden danger, they don't think they would have reached for those pills, and for whatever reason that they did. And so I'm so thankful for all of the amazing families and parents here in Oregon who were brave enough to tell their story about how they lost their kid because they didn't want that to happen to anyone else.
Welcome to InSight OnSite. I'm Wendy Brokaw. Fake pills laced with lethal amounts of fentanyl are robbing too many young Oregonians of their futures. In 2021 alone, there were 73 fentanyl-related deaths among people 15 to 24. Oregon ranks among the worst states in the nation for youth drug overdose deaths, and it is a national crisis. What's causing it? What's being done to address it? And what ultimately will it take to solve it? For answers, we talk to those on the front lines of this heartbreaking battle.
So the fentanyl crisis, really nationwide, but specifically to Salem, is the primary driver for overdoses in our community. And so we primarily see fentanyl and fentanyl alone in this community that are killing people. The heroin epidemic of the early 2000s, 2010 is gone. We don't see people using heroin like we once did. It is primarily fentanyl. In addition to that, polysubstance use is, where people use multiple drugs at once. 62% of overdoses in our community have multi-drugs, so polysubstance use. So methamphetamine, which has always been here, is more prevalent than ever. And then really we're seeing synthetic drugs push into our community from the East Coast. Drugs like carfentanil, which is much stronger than fentanyl, is here. In addition to that, we're seeing additives being added to fentanyl, drugs like xylazine that are strong tranquilizer type drug that people often prefer to use with fentanyl, which is much harder to treat in terms of someone who's experiencing an overdose.
The New Drug Talk is a program that educates parents across Oregon about just how much different the drug landscape is than when any of us were growing up and teenagers, and more importantly, how to support their kids' mental health and healthy coping and talk to them about drugs in meaningful ways. We really aim to meet parents where they are at, in their journey of educating themselves about drugs. The main thing that we always say, is that there are a lot of new things that are out there that weren't around when they were in high school, and it's really important to understand, the new realities that our kids face so that we can help them navigate those challenges.
We lost our 18-year-old son, Cal, in 2020 to a counterfeit pill that he had no idea and could have, and in fact did, contain fentanyl.
Our research shows us right now in Oregon, only about half of Oregon teens know that fake prescription pills even exist.
It's just easy for children to get these drugs nowadays. They can order them online, they can get them from their friends. The drugs are very prevalent in our community, and so these kids are resourceful and they know where to go to get these drugs. They don't always know what they're getting. Oftentimes drugs, or fentanyl specifically, is cut with other drugs, and they just simply don't know what they're going to get, and so you'll see overdoses as a result.
Unfortunately, similar to us, most of the parents of teenagers and young people that we've talked to, and there's lots, had no idea, like we didn't. I'm sure we had heard the word fentanyl before, but when we lost Cal, he nor we nor really many people at all knew that it was being put into pills that were being pressed to look exactly like real pharmaceuticals. And so we didn't even know it was a risk that was out there. And we had talked to Cal and our other son Miles about the risks of substance use, and even had talked about not taking pills from a friend and this kind of thing. But the day before Cal died, he had searched on Google for what is oxycodone, what will it do to me, what's a safe dose for my weight, and how will it interact with my anxiety medicine. And of course, he got only information about pharmaceutical oxycodone. And I'm not saying it was a good decision for him to buy what he thought was oxycodone on social media. It was a horrible decision, but he was going with the information he had. And we're pretty convinced that had he and other kids known about this risk, that literally one pill can kill, that they would have made a different decision.
Just say no is something that a lot of us heard when we were growing up. Just say no, just don't do it. And the research shows, that really doesn't work. And so what we teach is having open and honest conversations with our kids about the impacts of substances in today's drug landscape, particularly when it comes to, the number one thing that parents might not realize is out there in the drug landscape today, which are fake prescription pills that contain fentanyl. So these pills look like normal Adderall or Oxycontin or maybe a Percocet. They might be a medication that our kids are familiar with, maybe from having their wisdom teeth taken out, or maybe they have a friend that has learning differences. But the problem with these fake prescription pills is that they don't contain any legitimate medication at all. The majority contain fentanyl, and many have potentially lethal doses. So this is really a hidden danger in our community. Unfortunately, many of the kids that we're losing in the community never meant to take fentanyl. They thought that they were taking a legitimate prescription medication for one reason or another, and we're losing them to that. So that's really our biggest message to parents, is there are these new things out there that are really important to be aware of and make sure our children know about as well.
Here's a thing I'm hopeful about. Young people today are using substances less than they ever have before. Young people today responded to receiving knowledge and information about fentanyl and counterfeit pills rapidly and to great benefit, as we see the number of young people lost to fentanyl and counterfeit pills dropping dramatically. I am very hopeful that today's young people have a good mindset about their wellness and how to protect themselves and to care for their friends. So my hopes for the new drug talk and how information like this program could help families and help young people is putting the information out there in an accessible way that meets our young people where they are and shows them the real harms that can come from substance use without fear, without using fear as the main driver, and without scare tactics, and really meets these young people where they are to give them the information that they need to do what they are built to do, which is to grow up into healthy young adults with healthy risk taking and taking care of themselves and their friends around them.
We have to do a full court press on this issue in order to continue to see benefits. We are seeing declines in overdoses related at least to fentanyl, and that's encouraging. But we can't stop now. This is when you go all in on prevention and treatment, building, developing more of a treatment system and more ways to access at different points in treatment. And then of course, law enforcement plays a huge role in this as well. So we have to go all in order to see those numbers come down. We're not ready to rest yet on that decline that we're starting to see.
Real-time data, both locally and federally. We need that intelligence, and we need that intelligence now. We need to see what the trends are. We need to see the cross-sharing of information between agencies and collaboration between partners. So we need to see that communication occurring so everybody can solve the problem together, right? The Salem Police Department or your Salem police officer is not going to solve this problem alone. We have to communicate as a city, as a county, and as a state, and work together to solve the problem.
We want to look at a much more comprehensive and coordinated prevention education strategy for all ages within our community, because substance use affects obviously all ages. And we're also looking at, are there diversion programs? Are there opportunities to think outside of the box to help young people? There's just a number of strategies and steps we can take, but we need the community's input on that.
I'll reference a team like our HST or Homeless Services team, right? They're out there in the community having outreach with those experiencing homelessness. Often those people are addicted to drugs, they are addicted to fentanyl, and so just that simple ability to get out there, connect those people to service providers, and prevent that overdose from happening is absolutely key. Those are the types of things we need.
City Council was very supportive of the kind of coordinated and comprehensive approach that we're going to seek to work on. So it's fresh, it's new, and in phase one, we're engaging the community in different sectors by showing them this assessment tool that kind of helps with the SWOT analysis of it. And so it's helping define what does the city currently do in each of those three areas, what do different community sectors already provide in resources, services, supports of any kind, and then we look at gaps. What are we missing? What's missing? What needs to be improved a little bit more? That sort of thing. So this is a very coordinated and comprehensive approach that the city wants to lead on in our community. And it focuses on three areas: prevention, treatment, and enforcement. And we're inviting different sectors of our community and the general public to contribute with feedback on what gaps they may see in this system as we address substance use and lowering substance use, as well as just improving our community with different health factors. This is not just something that the city's going to roll out. We want to work with everybody around the table to really improve our health key factors and improve livability and just a stronger community overall.
Some of the advocates that we work with worked really hard to get a bill passed through the Oregon legislature that mandates fentanyl education in all Oregon middle schools and high schools. So what we like to tell parents here is to reassure them that the conversations that they're having with their kids about fentanyl and fake prescription pills at home, they might have already had in school. So it's a really great point of conversation to ask your kids, have you talked about fentanyl with your teacher in health class yet? What are they telling you? What do you know? And really starting that conversation to make sure that they're aware of this hidden danger.
I think what schools can also do is engage their communities. They can invite parents to come for a community night. They can send home the information that they're teaching their students in class to the parents and create conversations at the kitchen table, not just at the classroom table. And what our young people need to do is they need to hear it from all sides. They need to hear it at school, they need to hear it at home, they need to hear it from their doctor, because there are a lot of forces around our young people in our culture and in society. A lot of substances coming at them, a lot of commercialized things that can be harmful and be addictive, alcohol and cannabis, namely. And so they need to hear a warm embrace of their school and their family and their caregivers about this information and how to deal with the problems that they're having and where they can go for help. So I think if schools really engage their communities with this content, they could really create a powerful force to protect the kids.
We like to say that the drug conversation is 61-minute conversations, not one big long lecture. So just thinking about, on a weekly basis, is there a substance conversation that you can you check in with your kid and talk about their mental health? Can you show them healthy ways of coping, like going on a walk or reading a book? Really just that repetition over time, that talking with your kids, connecting with them, and also modeling healthy ways to cope, all layers in a really positive way. We say hope all the time. We really want, this is a really scary thing, but we really want parents to have the hope that they can do this. They can have the conversation, they can protect their kids. And our research shows us that once the conversation is had, once teens understand about this risk, they are far less likely to experiment with prescription pills.
Learn how the City of Salem is addressing the fentanyl crisis at salemor.gov/prevent-treat-enforce. The city has a new website dedicated to youth opioid prevention and awareness at cityofsalem.net/community/youth-opioid-prevention-and-awareness. A special thanks to all at Song for Charlie. For more information on their programs and services, visit them at songforcharlie.org. Thank you for joining us today on InSight OnSite. I'm Wendy Brokaw.